Thank you, Feng, for your presentation. Thank you again for this opportunity. And we publish many good papers, so it's difficult to establish which are the best papers. And to be objective, first I have to learn how to progress to the next slide. Chairpersons are so important, Feng. You solved the problem. This doesn't happen in Europe. In Europe, chairpersons are totally useless. While here, we can see that your contribution has been fundamental. So you're a wonderful chairperson. A big applause to Feng because really solved the problem. Now, I was saying, we publish many interesting papers, and it is difficult to identify which are the best. So not to be subjective, I follow an objective criterion. What I'll share with you are the top papers published in the journal in 23 and 24 based on the number of citations they received or based on the number of downloads. And these metrics are different because citation is a metric which reflects the interest of a paper among others, while downloads is the interest generated by the paper in the audience, in the readers of the journal. I will start with top citations, and top cited original article number 3, not surprisingly, is from China. It's a very elegant epidemiological study assessing the impact of ozone on admissions for cardiovascular disease. It's a large study in 70 Chinese cities, and the daily concentrations of different pollutants was taken every day. And you can see the results are quite impressive. A linear relation between ozone concentration and admissions for different cardiovascular disease, including coronary artery disease, heart failure, and stroke. An impressive linear relation, and this is the graphical abstract. We publish all our studies with a graphical abstract which summarizes the key point of the study. So a large study, more than 6 million inhabitants were assessed, and you can see on the right that the relation between the excess of ozone and admissions to hospital for different diseases is really remarkable. And the others conclude that acute exposure to ozone pollution is linked to increased hospital admissions for major cardiovascular diseases. Almost all our original studies are accompanied by an editorial which highlights strong and weak points of the study. This in particular was accompanied by an editorial by Thomas Munsell, who is the top expert in Europe on air pollution. And this is the graphical abstract. Please remember that ozone is generated by UV light and by warm temperature. So this is an increasing problem with global warming. And the deleterious effect of ozone have been well characterized, in particular generates endothelin, which is a vasoconstrictor, increases the autonomic function, and also increases inflammation, an important signal. And this is the top cited original article number 2, different topic. This is a Danish study on the prognostic role of elevated remnant cholesterol. It's a large study in about more than 20,000 individuals. Lipids were assessed, and you can see this remarkable relation between remnant cholesterol levels and cardiovascular mortality. It doesn't correlate with cancer mortality, but remnant cholesterol also correlates with other mortality, in particular infectious disease. The same is observed for triglycerides. This is the graphical abstract. Again, large population and clear results showing association between remnant cholesterol and cardiovascular mortality. And the others conclude that now we need trials addressing elevated level of remnant cholesterol. This is a brilliant editorial by Ulrich Laufs and his group. Well, what is remnant cholesterol? This is well clarified in this editorial. Remnant cholesterol is total cholesterol minus HDL cholesterol and minus LDL cholesterol. What is left is cholesterol in lipoproteins rich in triglycerides. Now, this remnant cholesterol is important not only because, as you've seen in this study, is associated to cardiovascular risk, but remnant cholesterol is not reduced by statins. So drugs we are using to reduce LDL cholesterol are not effective on remnant cholesterol. So we need new drugs which address also the issue of cholesterol in remnant, which address the issue of remnant cholesterol. And there are trials going on in this direction, which probably will give some interesting results. And we come to top-cited original article number 1. This is a post-hoc analysis of a trial, the paradigm, which addresses an issue which generated some interest in the past years, the so-called obesity paradox. Some studies found that in patients with heart failure, obesity is associated to a better outcome, which is interesting and unexpected. Well, this study shows that this is totally wrong. This paradox doesn't exist. They assessed several parameters of adiposity, including BMI, but also parameters which are independent of body mass index, and in particular, considering parameters independent of body mass index, and after proper adjustment, well, you can see that obesity correlates with all relevant outcomes, from cardiovascular death to hospitalization to all-cause death. So the paradox doesn't exist. This is the graphical abstract showing that also when considering BMI after adjustment, we have a signal showing correlation, but this is more evident when parameters independent of BMI, like the waist to height ratio, well, using these parameters, the obesity paradox doesn't exist. And the clinical implication of this study, I think, is important because this study shows that in patients with heart failure, intentional reduction of body weight, as we can do now with, for instance, GLP-1 receptor agonist, is an interesting target to test in the population of patients with heart failure and obesity. For this particular study, we do not have an editorial. So I move from top-cited articles to top-downloaded articles. Again, this is a metric different from citations and mainly reflects the interest of a paper among readers. And this is the downloaded article number 3, transcatheter or surgical aortic valve implantation. And this study is a follow-up study of the NOTION trial showing the outcome as 10 years. This is extremely important because, you know, with TAVI, durability of valves remains an issue to clarify. Again, post-hoc analysis of this trial where patients with severe stenosis were randomized to TAVI or surgery. And you can see that the primary endpoint is identical after TAVI and after surgical replacement with a biological valve. So these results are very reassuring and are among the first results showing excellent durability of these valves. Graphical abstract, again, the design of the study, patients were randomized, clinical endpoint was similar, and interestingly, the deterioration of the valve was worse after surgery than after TAVI, another reassuring message for TAVI. So the authors conclude that based on this data, long-term performance after TAVI is excellent and similar to surgery. And this is the accompanying editorial highlighting the main points of the paper and the limitations. Key point is similar outcome after TAVI and surgery. The main criticism is the use of non-optimal surgical valves and also the small study size. A learning point is that each procedure is associated with specific side effects. For TAVI, mainly paravalvular leak and permanent pacemaker implantation. For surgery, mainly patient prosthesis mismatch and atrial fibrillation. And this is the top downloaded original article number 2. This is a surprising study from Belgium, lifelong endurance exercise and relation with coronary atherosclerosis. We all know that exercise is good for our heart and good for our arteries. But what about excessive, so to speak, exercise? In this study, they assessed 191 lifelong endurance athletes, same number of late onset endurance athletes, and controls. And the primary endpoint was the assessment of coronary atherosclerosis at non-invasive coronary angiography. And again, the results were impressive because patients, lifelong endurance patients, doesn't matter which parameter we consider, had more atherosclerosis than controls. And the late onset endurance athletes had intermediate severity. So this is the graphical abstract which summarizes the notion that lifelong endurance atherosclerosis had more atherosclerosis than controls. And this is the very straightforward take-home message. The editorial from Michael Papadakis, one of the top experts in this field in Europe, discusses another paradox, the paradox of coronary artery disease in veteran athletes. And the message is that, well, exercise is fine, but perhaps the excess of exercise is not positive. This is something a Latin poet wrote more than 2,000 years ago. He wrote, in medio stat virtus, which means the virtue is in the middle. So exercise is fine, but the excess perhaps is not so positive. And this is the top downloaded original article number 1. We come back to Asia. This study is from Korea. It's a massive nationwide study enrolling more than 40 million inhabitants. It's a nationwide study. And vaccination, in particular with mRNA vaccines, is associated with higher risk of myocarditis. But the overall incidence of myocarditis is very small, about 1 per 100,000 vaccinated persons. The incidence, the risk of myocarditis after COVID is 100 times higher. But when myocarditis is there, we must be watchful because about 20% of patients who present myocarditis after vaccination need admission to ICU. This is the very straightforward summary. The risk is there, but is very small, and only 20% of patients with this very small risk of myocarditis need access to ICU. And here we move from original articles very quickly to reviews. I've made the same exercise done for original articles also for reviews. Top cited reviews and top downloaded reviews. This is the top cited review number 3, pathogenesis and management of abdominal aortic aneurysm. I think this review is very interesting because the abdominal aortic aneurysm these days is treated by surgery. We don't have pharmacological treatment. And this study explores potential drug therapies to test in the future and potential treatment targets. Top cited review 2, number 2, is a review on sarcoidosis. Please read this review, because I have the feeling, at least in Europe, in Italy in particular, I don't know about China and Asia, but I have the feeling that we tend to underdiagnose sarcoidosis. We don't identify these patients. This is a nice review which summarizes the main manifestation of sarcoidosis, the role of diagnostic biopsy, the role of diagnostic imaging, and the therapy and factors predictive of worse outcome. Very informative. These are patients we cannot miss, also because the treatment, once the diagnosis is made, is extremely effective. And here we come to top-cited review number 1, is about Mendelian randomization studies. These studies are very important because allow to establish a cause-relation effect when an association is observed in epidemiological studies. Please focus on this square. First line, this 3 red box. Well, we know from observational study that there's an association between abdominal aortic aneurysm and ApoB, Lp(a), and cigarette smoking. Now, the question is this association causal or not? Well, Mendelian randomization study allowed to establish causality because in this case, gene predisposing for high levels of these intermediate parameters, ApoB, lipoprotein, cigarette smoking, genes associated with these intermediate parameters are also associated with abdominal aortic aneurysm. This is an elegant way to establish causality when associations are present in epidemiological studies. And here we move from citation to downloading, and this is the top downloaded review number 3. Please note the first author is Jean Braunwald. Jean Braunwald, who is very popular also in this country, celebrated 95 years in August. 15th of August, he celebrated the 95 years and is still extremely active. And please consider, this review is on mavacamten, which is the first drug which is able to reduce the gradient in patients with obstructive hypertrophic cardiomyopathy. Well, Jean Braunwald was the first to describe obstructive hypertrophic cardiomyopathy in 1958. Was about 60 years ago. And after 60 years from the description of this entity, here he reviews the growing role of these drugs, myosin inhibitors, in the treatment of obstructive hypertrophic cardiomyopathy. And this is the top downloaded review number 2, is on the role of cardiac rehabilitation, the Cinderella of treatments in cardiovascular medicine, in particular in heart failure. Well, we know that there are 4 pillars in the treatment of heart failure: ARNI, beta blockers, MRA, and gliflozin. They say, well, we have a 5th pillar, which is cardiac rehabilitation, which is frequently forgotten, and it is extremely important in improving the outcomes of these patients. And this is the top downloaded review number 1. Is a study from Australia on vegetarian and vegan diets. Well, we all know that vegetarian diet is good for the heart, but here they point out that not all vegetables are good for the heart. There are healthy vegetarian diets, but also unhealthy vegetarian diets, including refined carbohydrates, sweets, sugar-sweetened beverages, vegetarian ultra-processed food, and trans fat and tropical oils. So vegetarian food correlates to a better prognosis regarding cardiovascular disease, but we must be very careful in the choice of the vegetarian diet. So this is my last study today, the top downloaded review. And of course, read the European Heart Journal to learn much more. I mean, 20 minutes, it is impossible to summarize all the interesting things we publish. And please don't forget that tomorrow at 17 in room 207, The editors of the ESC journal family who are here today will meet all of you. It will be an informal meeting. So if you're interested today, the time is limited. Tomorrow we will spend 1 hour together. It's an informal meeting to have questions from all of you. And you all cordially invite to this meeting tomorrow at 17 in room 207. Thank you for your attention.